I think as we dive in, I want to first give some context to the conversation here and just really the need for equity in the industry. So I'm sure everyone in the room is familiar with the term drug war. And quite frankly, the war wasn't really about drugs. It was a war on people, particularly low income, Black and Latinx folks. And so what we know is that over the years, Black and Latinx people have been disproportionately arrested, charged, convicted, and otherwise had their legal rights taken away from them because of these consequences that are, for these convictions rather, that are now becoming legal activity. So I think that's just the framework from which we're working. And what we know is that these folks who do have these convictions are often barred from our society in a number of very important ways. For example, here in California, there are about 4,800 collateral consequences that come attached to a felony conviction. And about 75% of these are directly related to employment. So if you can understand, the pressure that puts on a person who's seeking employment after having one of these convictions, I mean, it's near impossible to get a high-paying job to really take care of oneself and their family. So, as legalization takes course both here in California, elsewhere across the country, it's really important to ensure that the folks most harmed really get a place in this new industry so that they too can benefit financially and really overcome many of the challenges that have really ravaged their families and communities at large. So I want to pass it along to Shaleen and Kat just to talk a little bit more about why we need equity, why it's important right now, and what, the origins of this conversation.
I had an opportunity very early on to be a part of a marijuana legalization campaign in Ohio. And I think this is interesting because you fought very heavily against this campaign. But when I first joined the cannabis policy space, I had an opportunity to be a part of a legalization effort that essentially would have been a monopoly, would have created a space where there would not have been additional opportunities for folks to join the industry. And I saw very easily how this industry and this market could move along without even having a conversation or creating space to acknowledge the real harms that folks had experienced. I had an opportunity to move across the country from Ohio to join the Drug Policy Alliance in its effort to pass what at the time was the most social justice oriented cannabis campaign. And I remember at the time, drug policy organizers were trying to figure out where they were going to kind of draw the line in the sand. And actually, we've seen the same thing come up most recently with the federal hemp provision. And it's essentially this conversation of what types of drug policy reforms are we going to champion, and are we comfortable passing cannabis policy initiatives that do nothing to forward social justice and do nothing to acknowledge and bring along those communities who have been historically harmed? I think that it's very obvious and transparent to say that, yes, it can happen. We can move along and have these conversations without including things that we would consider to be very, very important, but that's not the type of cannabis policy that we want to support and champion. California at the time when it was passing its Proposition 64 had provisions to allow for expungement and resentencing. We've seen most recently that there are efforts to make that particular provision automatic. That, of course, in my opinion, needs to be a baseline for all cannabis policies. If we're going to move forward, we need to allow folks to be able to have their particular records expunged. Also, what we've seen is California take an intentional effort to include folks who have passed cannabis records to allow them to be a part of the industry. We have to, at the very least, acknowledge that even in the state of California, it is still a crime to engage in a cannabis business unless you have a license. And so if the communities who have been historically targeted and experienced harm because of their engagement with cannabis activity do not have access to licensure, they will continually be criminalized as we move this conversation forward. So part of this equity conversation legitimately is an attempt to continue to try to keep folks out of criminal, essentially looking at folks through criminal lenses.
Thank you both. I think I want to now take the conversation a little bit further and talk a little bit about what the creation of these programs look like and some of the challenges that you all had in creating these programs. I know that several studies were commissioned across the state of California in different jurisdictions that were interested in equity. Could you just describe what came of those studies and what then pushed these localities to adopt these equity programs?
It's interesting, again, communities, particularly low-income communities of color, have been acknowledging and asking government to recognize this harm for decades. But government also often needs data before it can move forward. So I think that part of what we're recognizing is that we had data before, but there was a certain type of data that we needed in order to feel comfortable moving forward. I think that part of what we did in the city of Los Angeles was largely based off of the fact that when we were creating an equity program, at the time there was only one jurisdiction in the entirety of the United States that had a model for equity at the time. It was Oakland. And they had started the development and the creation of their equity program with a social equity analysis. And the social equity analysis really tried to understand, both on an individual and a community level, who were the individuals who were impacted by cannabis policy and what were some of the barriers that they faced in trying to come on board to the regulated market. So we brought on a consultant to come in and essentially do a heat map all throughout Los Angeles and figure out which communities were impacted. We created programming that essentially gives priority and other types of assistance to folks who have been identified, and I'm sure we'll talk about the challenges in actually getting from policy on paper to programming in front of communities. But it's important to have that analysis up front because there will undoubtedly be folks who want to say, well, why do you need this program? Why is this affirmative action in the cannabis industry? Why can't we have a program for women or veterans or members of the LGBT community? And part of this is a conversation around acknowledging the difference between diversity, equality, and equity, and also acknowledging the characteristics of the individuals who have been impacted. But we had this study early on, and this has guided our framework of how we've been able to move forward.
So in Massachusetts, we were lucky in a couple ways. First, because so many states had gone before us, and the statistics of the demographics of the licensees were so unquestionably awful, that helped us have some leverage and a clear way to explain that there was a problem and that we need to address it. We were lucky in the fact that Massachusetts, being a generally progressive state and usually not resistant to being a leader, we were able to put together a very broad coalition of pretty influential organizations that would not support a legalization initiative unless it included strong provisions for an equity program. So that was included in the ballot initiative, which passed, and then the Massachusetts legislature in 2017 rewrote the law, and based on public pressure, they actually made it stronger. So they added an economic empowerment priority program, which didn't work.
So I think now I want to dig a little bit more into Kat and Shaleen's respective programs. As Kat has said, she works here in Los Angeles, and there's a Los Angeles social equity program, whereas in Massachusetts, there's a statewide program. And I'd like for you to both first start by just describing some of the criteria for entering these programs and to become part of this program, but then talk about some of the benefits and some of the drawbacks of having a statewide or a local program.
The equity program, the way that it was built in the state law was two different programs. So the first is the economic empowerment priority that I mentioned. And the difference between the equity program and the priority program is the equity program is for people who are from the disproportionately impacted communities. So that was what was written in the law. As regulators, we had to interpret that phrase. And there are different ways that you could define the term community. It can be places, it can be people who have been affected by different laws, It could be if your family has been affected. And so we went in all three of those directions. So the first way you can qualify is if you lived for 5 of the past 10 years in an area that was designated. And we did a study, those are public, of arrest rates around the state to designate those 29 areas. Most of them are cities and towns, but the 4 cities or towns, but the 4 cities with over 100,000 population, including Boston, were too big to designate. So we focused on neighborhoods that were subdivided as disproportionately impacted areas. So that's the first way to qualify. The second way to qualify is if your parent or spouse has a drug conviction. And the third way to qualify is if you have a drug conviction. There's also an income limit of 400% of the poverty level if you are qualifying by residency. So that was a deliberate decision to make a race-neutral qualifying list of conditions, and that was definitely a hard decision because I think it's very well documented that people of Black and Latino descent are the communities disproportionately impacted. However, we decided after a lot of discussion that this was less likely to be constitutionally challenged and still likely to cover the communities we were trying to cover. Now, the Economic Empowerment Priority Program was different. This was about who would get to open first and get a head start. So under the Massachusetts law, like many ballot initiatives, it was not passed by legislators. It was passed by the people, and it costs money to run a campaign. And the medical dispensaries, this is very open facts. The medical dispensaries contributed to these campaigns. So what did they get out of it? They got priority to open first. That's also, I think, for a lot of people, considered an efficient way to get the market off the ground, especially us being a brand new agency. It already took, a year to get stores to open. So to offset that priority, there's also priority for, and this is the language under the law, businesses that can demonstrate that they have promoted or will promote economic empowerment in those communities. So think about someone who has a reentry program, someone who has a workforce training program, someone who goes out and gives seminars on economic empowerment. So you could qualify in all different ways to be part of this priority program. To make it something that a lot of different people could qualify for, we made up 6 criteria, one of them being race-related, ownership for people from Black, African American, Hispanic, or Latino descent. The others mostly have to do with hiring and ownership. And then the last one was open-ended, any way that you can show that you have these business practices. So under the law, that period was open for 2 weeks in April 2017. And we got hundreds of applications, 123 of them qualified. And so the benefit that they got is when they apply, like medical dispensaries, they go right to the front of the line, and in theory, they should have opened first. We did not get one application from any of the 123 that were able to make it through the process. So we did a survey to ask why, and the top 3 reasons that they gave were, 1, they just needed time. They weren't ready to go through the full process. 2, a lack of capital. And 3, the local process being too difficult. So in Massachusetts, at the state level, there's no caps. It's just either you qualify or you don't qualify. But at the local level, not only can a city or town set caps, they can come up with basically any reason whatsoever to choose the businesses that they choose, including accepting money called a community impact fee. That community impact fee is supposed to be limited to a certain amount, 3% of gross revenues, but cities and towns are accepting a lot more money than that, which is, I think, leading to us not receiving applications from the populations we want to see. So that's the current state in Massachusetts. I think that this coming spring, as we start to look at new lower capital licenses, specifically delivery licenses and social consumption licenses, that we'll finally start seeing the applications we want to, because as we started to see this data come in, we made a decision that these licenses will be reserved specifically for equity program participants, micro businesses, and cooperatives.
So the development of equity programs here in the state of California has largely been led by local jurisdictions today. We have a tiered program, so there are a number of different ways that folks can qualify. Essentially, we are requiring, in order for businesses to get priority processing, part of the challenge that is that we're dealing with a highly regulated industry that is capital intensive, that is constantly evolving, and one of the most immediate barriers to entry is information. And this is information that is constantly changing. Here, there can be a lot of confusion. When government isn't sharing information or isn't sharing accurate information, you have folks who come in to fill that space, and then they are seen as the primary sources of information, and then folks can get taken advantage of. So what we've seen here in the city, even most recently with the development and implementation of our social equity program, is that folks had a lot of questions. And because there were a lot of different variables that had not been determined yet, there were a lot of questions that we weren't able to answer. Private individuals and organizations stepped up and started to answer some of those questions, and some with bad intentions and some with good intentions. That information wasn't always accurate, and so there are many barriers to entry. I think that collaboratively having conversations with folks who are implementing programs and social equity applicants themselves, leading conversations and us not making assumptions about what folks need, and actually listening to communities and allowing that type of data to drive decisions is going to be key.
One thing I've heard over and over, especially in more urban cities like Boston, where there's not a lot of real estate, is that city councils will leak in advance to people with connections what the zoning will look like, and then some companies can afford to just snap up those properties and pay 10 times as much rent and wait and see what happens, and that leaves everyone else, it's a non-starter for them. So location's definitely a big challenge. One thing that I get asked a lot is by states with existing programs that weren't able to include equity from the beginning, like Massachusetts, what can they do? I think really that the future of equity is in these newer, lower capital licenses, especially since most states don't have delivery only. Most states don't have on-site consumption yet. In Massachusetts, we are starting both of those with pilot programs, and as the people at this conference will especially appreciate, we're making sure those pilot programs are evaluated very well and that all of that data will be open and transparent. That's the first thing. And then the second thing is just to keep the public pressure up. There are so many things in Massachusetts that I think we would have just sort of floated away if the public pressure didn't stay on, and if people weren't talking about these things in plain terms in the way that an ordinary person who's just half paying attention can understand and speak about.